I am Raji, working in Central Government Office. Here we have Sri Shankar, Chief Accounts Officer with us to address questions and clarify doubts regarding CGHS. Welcome, sir.
Thank you, madam. It's a pleasure for me.
What is CGHS and who is entitled to avail this facility?
Central Government Health Scheme. Central Government employees and their dependent family members are entitled to avail this facility. CGHS has various dispensaries all over the country. They can take treatment at these dispensaries.
Are there any charges to avail this facility?
Yes, definitely. To avail this facility, employees has to pay subscriptions from their salary. Monthly, they have to pay subscription to avail the CGHS facility.
How to enroll with CGHS to avail this facility?
To enroll, to get the CGHS beneficiary card, they have to download the form from the CGHS website and complete the form. They have to submit with the admin section along with the address proof for the dependents. On receipt of the form, admin section will endorse the application and forward it to the CGHS office. CGHS office will scrutinize the application. For the entitled officers, they will issue the CGHS beneficiary card. Main entitlement is the resident should be within the CGHS area.
Is it possible to include father, mother, father-in-law, mother-in-law as CGHS beneficiaries?
Yes. Any employee can add their father, mother or father-in-law or mother-in-law. They have the option either for father, mother or father-in-law or mother-in-law, provided there should be a dependent of the particular employee. Dependent means their monthly income should be less than or equal to 9,000 plus the DA at the time. If their monthly income is lesser than that, they can include either father, mother or father-in-law or mother-in-law as their dependent.
Could you please explain the procedure for beneficiaries to avail CGHS services?
Definitely. If the CGHS beneficiary are facing some health issues, they have to report to the CGHS dispensary. On reporting there, they will be directed to approach a physician who is available at that time. The physician will examine the CGHS beneficiary and recommend the further procedure. If the physician recommends some medicines, it will be supplied free of cost by the CGHS dispensary itself. If the physicians recommend further consultation, then the physician will issue a referral letter to get the consultation from the Empanelled hospital.
How can an employee avail CGHS service while on tour or at an outstation?
Wherever they are in the country, whenever they are facing some health issues, they need not go to their particular CGHS dispensary. They can visit the nearest CGHS dispensary. The beneficiary card is the universal card. They can produce it at any dispensary and they can avail the facility at the dispensary nearest to them. So they can avail the facility while tour on outstation.
What is the procedure to avail medical facilities that are not available under CGHS dispensary?
Suppose the beneficiary on examined by the physician at the dispensary finds further examination by a specialist, suppose by a cardiologist. If the cardiologist is not available at the CGHS dispensary, then the physician will issue a referral letter to the beneficiary to get consultation by at the cardiologist at a Empanelled hospital. So, on obtaining the referral letter from the CGHS dispensary, the beneficiary get this consultation from the cardiologist at the Empanelled hospital.
What is Empanelled hospital or HCO?
CGHS has list of hospitals and healthcare organization for every city where on obtaining a referral from the CGHS, the beneficiary should approach the Empanelled hospital to get treatment and a healthcare organization for investigations.
For the medical facilities that are not available under CGHS dispensaries, why are beneficiaries required to visit only Empanelled hospital or HCOs?
On referral, the beneficiary should visit only the Empanelled hospital because the Empanelled hospital will charge only the CGHS rate. CGHS has fixed rate for every treatment and investigation. The Empanelled hospital will charge only the CGHS rate from the CGHS beneficiaries.
Can you please describe the procedure for availing treatment at an empaneled hospital?
On obtaining referral from the CGHS dispensary, the beneficiary should submit the referral letter and the CGHS beneficiary card at the empaneled hospital. Then the empaneled hospital will charge only the CGHS rates from the beneficiary. For example, for consultation with a specialist, they will charge only 350 towards the consultation. They may charge more than 350 for the general patients. For CGHS beneficiaries, they will charge only 350. On paying the consultation charge, they have to obtain consultation from the specialist. Then if the specialist prescribed some medicines or further investigation, they can do the investigation at the same hospital without further referral from the CGHS, whereas they have to obtain the medicines only from the CGHS. It will be supplied free of cost to the subscribers.
How to get reimbursement for the expenses incurred by the CGHS beneficiary during his treatment at empaneled hospital?
At the empaneled hospital, the beneficiaries may incur with several expenditure like consultation charges for investigation. If they have been admitted for some procedures, then room rent, then operation charges, then medicines. So many expenditure they may be incurred. After discharge from the hospital or after completion of the treatment, they have to submit the medical reimbursement form along with all the vouchers with the admin section. Since the empaneled hospital charged on par with the CGHS rates, they will get full reimbursement for the all expenditure incurred at the empaneled hospital.
Can an employee get treatment without CGHS referral?
Yes, in certain emergency situations, when the situation is not under the control of particular employee, in case of accident or in case of when the dispensary was closed, when the employee or their dependent family members or when they face some health issues, they can get treatment at the empaneled hospital without referral. So they are not in a position to obtain a referral. In the case of accident, they may be admitted in an emergency situation at a hospital. Whether it is a empaneled hospital or non-empaneled hospital, in an emergency situation, the employee can get treatment. If it is the empaneled hospital, their expenditure will be reimbursed in full since the charges were levied only based on the CGHS rate at the empaneled hospital. For the expenditures incurred at the non-empaneled hospitals, the employee may not get the full reimbursement because the hospital may charge more than the CGHS rate. So their medical expenditure and their claim will be restricted to the entitled CGHS rates.
How to substantiate the emergency situation?
After completion of the treatment or at the time of discharge, the employee has to get one emergency certificate from the hospital which says the patient has been admitted on such and such condition on emergency basis. On investigation, the patient has been done with the following procedures. It contains all the details. That emergency certificate will prove the situation is emergency, so the employee without the referral obtain treatment at the hospital. That is sufficient for the employee.
How can an employee residing outside CGHS area get treatment?
For the employees, those who are residing at the outside CGHS area, suppose one person does not know whether they are residing in a CGHS area or non-CGHS area, they have to make a call to the CGHS additional director office. If they provide their PIN code number, then the additional director office will inform the employee whether the residence is in CGHS area or non-CGHS area. Suppose the employee is residing in a non-CGHS area, then they have to get consultation from the authorized medical attendant, AMA. Authorized medical attendants. Registered medical practitioners has to register with the cadre control office. The cadre control office used to issue list of AMAs. Those who are residing outside the CGHS area has to check the list and find who is the AMA nearest to the residents and they can take treatment with the AMA.
How to get the reimbursement for the expenses at AMA?
The AMA charge consultation charges. Then the AMA may refer to take some medicines or further to take some investigation. For the expenditure of the consultation charges, the medicine purchase charges and the investigation charges, everything will be reimbursed to the employee on submission of medical claim with the admin section.
Are we eligible for advance for medical treatment?
Yes, advance is available up to 90% of the CGHS package rate. For example, if the CGHS beneficiary has been advised to go for a bypass surgery, then there is a rate for bypass surgery, CGHS rate. For that rate, they are entitled for 90% of that amount as advance.
What is the time limit for submitting medical claim?
6 months from the date of completion of the treatment or date of discharge, the employee has to submit the medical reimbursement, medical claim with the admin section. That is the time limit to get the medical reimbursement for the expenditure incurred by the employee.
Sir, thank you very much for explaining in detail about medical reimbursement. Thank you.
Welcome, madam.